You are listening to The Pilgrim on the 405 with Will Christ. Join him as he and his guests discover how businesses thrive in California.
Well, welcome to The Pilgrim on the 405. We have a very interesting, cutting-edge, AI-enabled system for helping people who've suffered from malpractice find the right attorney. We have Victor Bornstein, the founder and CEO of Justpoint. So welcome to The Pilgrim on the 405, Victor.
Thanks so much, Will. Thanks for having me.
So tell us a little bit about what Justpoint does.
Sure. So what we do right now, the first product is that we connect people who suffered a medical mistake and are looking for an attorney to the right attorney for them, for their case. And it's something that I'm sure that people have seen all those ads of attorneys on TVs and, bus stations, bus stops. And it's attorneys are spending a lot of money to market themselves. And those attorneys are not necessarily the best attorneys for each case. They're not necessarily the best attorneys for any case. They're just attorneys spending a lot of money marketing it. So it's difficult for the consumer, once they suffered something that they believe was a medical mistake, to find the right person for them. So what we do is that we use artificial intelligence in a database of 300,000 historical claims to find the right attorney for each of those claims. And that's our first product. Our second product might be interesting for the other side of the audience, because I feel like this space is very divided into two sides, is that we're also developing products for the defense side to make sure that frivolous lawsuits don't come to harm hospitals and insurance companies and doctors.
So where did this idea come from?
Yeah, so I used to work at Bornstein Hospital. I was in New York. I was a professor, and my role was to develop technologies for the hospital system. And before then, I was working at the Texas Medical Center in Houston. It's one of the largest medical systems in the world, actually. And doing the same thing, developing technologies for the hospital system, making sure that we could optimize operations, decrease medical mistakes. And I had a list of hundreds of issues that could be addressed with technology. And as we know, that there's a lot of things that can be optimized in any industry. But since I focus in healthcare, I was focusing on hospital systems. And I realized that the medical practice industry overall, it's very inefficient, not only all sides, the plaintiff side, the doctor side, it's very inefficient. And an industry that's so important and affects the lives of so many people in the United States should be optimized, and it should be making sure that you don't have too many false positives or false negatives, meaning lawsuits that are frivolous or they are receiving payouts, or lawsuits that are real and are not receiving payouts. So the idea was to, after I saw this over and over in the hospital system, how inefficient the medical malpractice system is, the idea was to jump out of the hospital and just build a company myself. And that was in mid 2018. So now it's going to be 3 years now.
And you got a big boost last September, right?
We did. Yeah, that was good. We got some great investors. We raised 1.3 million, and we were very lucky to get some of the biggest names in these industries. So we got one of the biggest names in healthcare, Vivek Garipalli, the founder of Clover, to lead a round. We have one of the founders of Atrium, which was a health technology company. And we have also insurance companies invested in us, doctors, medical malpractice, law firms. So we're very lucky not only to raise a round, but to raise it from such experts in the field who we talk every week, and they help us build the business. It's so good to have people who understand their specific niche much better than you do, because they become thought partners with you, right?
Right. Well, and what I find so interesting is that as an entrepreneur, what I see you doing is you saw a problem and you decided to solve that problem using technology, in this case, artificial intelligence, right?
Exactly.
And that is the role of the entrepreneur, to see a problem, come up with a solution, and if it's viable, then investment will come.
Yeah, it's so interesting. Like, I was talking about this with my wife over the weekend, actually. We moved to Colorado since COVID, so we go skiing every week, and there's a lot of time to chat about everything, right? So we were talking about all the things that we noticed that have to be fixed. And it's interesting, right? Because once you get into this mindset, you keep looking for things to be fixed. And I have a notebook that whenever I see something that could be improved, I write it down. Now I have hundreds of ideas. Some of them are not startups, right? Some of them are things that could be optimized for daycare during COVID.
Right.
And that's not necessarily something that I'm going to, create a startup around, but those are all problems. Some of them, I would say 10% of them could be startups. Maybe 90% of them are not. But I think that the trick to have, the way that I see the trick to have a good idea is to have hundreds of ideas and then removing the bad ones. And then you keep probably a few of them that could be startups.
In the entrepreneurial operating system, EOS, we call that the visionary in the organization. And the visionary does have hundreds of ideas. In fact, he or she can be very disruptive to an organization. It can become very dysfunctional if the visionary is caught in what we call the integrator's seat. The integrator's role is to help the leaders on that leadership team work together harmoniously to achieve the vision, to achieve the goals of the company. The visionary, if he's ever caught in that integrator seat trying to be the integrator, comes up with these great ideas, and 90 days later, he or she are onto a whole different thing, and the rest of the company is just beginning to understand it and to start moving that direction. And eventually, they'll just give up on listening to the visionary because there's just too many ideas. Which
you might get going back and forth and not moving.
Absolutely,
forward, right?
You get this 90-day spike up and down, and so. At the same time, that visionary plays a very important role in the culture of the company and the core values, and also in looking out over the edge, knowing what's going to happen on the other side of the curve or the other side of the hill. So it's getting those roles very clear. Who's responsible for making it happen? Who's responsible for seeing what might happen?
No, that's absolutely right. I think that the other thing that I think the visionary role is helpful is to recruit people, because you can sell the vision, you can tell how things should be, and then people get excited about it.
Yes.
But it's absolutely right? If you don't execute properly, it's not something that's going to happen, right? You have to, everyone has ideas, right? But the capability of executing correctly. So in the team we have, it is interesting to detect who is who in that scale. And I think it's a scale, right? Some people are more this way, some people are more that way, some people are more in the middle.
Yeah.
And understand their strengths and make sure that you position them in the right places.
That's right. So you have absolutely the right people who agree with your core values, and also have people in the right seat, which means they get what their seat is. They understand what it means and how to do it. Then they want to do it. They're bouncing out of bed to do it. And they have the capacity, the God-given talent to do it. Getting those two things, right people, right seat, that's what makes it work. It's exciting to see that, because without the right core values in your company, people could do a lot of harm, couldn't they?
Yeah, definitely.
I mean, what attorney doesn't want to have a piece of an $8 million malpractice suit?
Exactly. Yeah, and that's one of the challenges that you have, is making sure you align all incentives. And the way that we do, like, for example, on the pricing model, is that we only get paid if we actually help the claimant. We don't get paid if just person per lead, which would be incentivizing us to send the maximum number of leads to all attorneys. So it's interesting you mentioned this. I believe a lot in game theory, and that if you set those incentives correctly, you are more likely to get the behavior correctly, right?
Yes.
So that happens in all levels, in pricing of the product, in culture, making sure that you're compensating. If you have a bonus structure, you make sure that you give the bonus for the right thing.
Yes. When you're helping an attorney to get the right case, you're helping them to clarify even more clearly what their niche is, right? What their core focus is. Because if they are being successful in prosecuting, you're not prosecuting, but in bringing malpractice suits to a successful conclusion for their clients, they're going to want to do that more and more. They become better and better at it, right?
Exactly. And I can give one example on this. What we do on the plaintiff side is that we understand how the claimant, that claim is, how it's shaped, if it has merits, right? If it has, how much should be receiving. On the lawyer side, we understand which are the lawyers that would have the most predicted success on that claim. And then for that, we have to understand where they fall in the percentile for each type of claim. So someone, let's say attorney John Smith, he might fall in the 10th percentile for misdiagnosis, but on the 90th for wrongful death, or on the 50th for birth injury. So in the end, we understand what they do better. And for them, it's actually better to get those cases that they do best.
Yeah.
And some of them might be because they have doctors in-house they hire, and that doctor is, let's say, cardiologist. So they do cardiology cases super well, but they don't do misdiagnosis of cancer that well. And then we understand this, and in the end, it's helping the plaintiff and the law firm. And also by detecting if the case has merits, and not even going forward and talking to the attorneys if the case don't have merits, we end up helping the defense side as well by not bringing lawsuits that don't have any merits, and then lawyers just feel rushed to get something from them because they have some cost and they had to spend $100,000, $200,000, $300,000 on it, and now they get to get something from it. But by detecting this in the first hours when we talk to a claimant and we get the medical records, we spare basically the whole system from all this burden.
Mm-hmm. Well, I mean, you're really performing a wonderful role. Number one, in helping victims of malpractice, right? And what was the number of how many malpractice incidents are there in the country? Medical malpractice.
So the numbers vary. So if you count the number of medical mistakes, every year there's a predicted 300,000 to 440,000 to 440,000 a year, which is close to the number of deaths from COVID. So that's just deaths, right? So there's also medical malpractice that did not result in death. So it does affect a lot of people. So yeah, that's the number.
And they should be compensated for their loss, right?
Yeah, so I can give one example that we just helped recently. It's she was a psychologist in California and suffered issues that were unfortunate. She has to go to the doctor, and in the doctor there was a drug interaction issue because they didn't have enough anesthetics from one of the types. They ended up having to mix it so the patient wouldn't wake up in the middle of the surgery. And then because there was drug interaction, she actually had cognitive issues that are permanent from that. And she cannot now work, she cannot function properly. So she was the one bringing the money to the family. She has 2 kids. And of course, now the family doesn't have an income, right? And it's extremely unfortunate. And it's not honestly just about the income, right? The person lost their cognitive function. So she's not going to be the same for the rest of her life. But then what happens to the children right now? Because of this issue, the family suffers. So the way we see the medical practice system is that it affects, it's a system to serve the individual, but it also affects the system, right? So we focus a lot on the individual, people who had their lives changed because of a medical mistake. But we also try to make sure that when we affect the system, because we do with lawsuits, you always affect the system. You create, as we were talking about game theory, you create behaviors that doctors might follow or not to prevent being sued, right? Mm-hmm. So how can we affect the system in a positive way as well, not just helping the individual?
So often in the public mind, malpractice suits are either seen as frivolous, or they're seen as punishing bad behaviors in doctors, and so it's a punishment for the doctor. It doesn't have to be a punishment if it's an actual mistake or a bad choice. It doesn't have to be a punishment. It can be like what you're suggesting. It's a learning experience for the system, right? Oh, yes, don't do those things. Don't do those things.
Yeah, so it's funny you mentioned this. So our technology allows us to detect potential medical mistakes in the future.
Mm,
So one of the things that we are now discussing is with hospitals to detect what had been mistakes they've made, but had not been addressed yet. So
hmm
they can proactively address them before they become lawsuits, right? Because the idea is, how can we get feedback? So we know nowadays that 3% of doctors cause most of the mistakes. So over 50% of the mistakes are caused by 3% of doctors.
hmm
And sometimes they are a matter of re-educating. Sometimes just a side effect of a surgery that, another surgery should be done. Sometimes it's unavoidable. Mistakes happen. Everyone makes mistakes, right? But the ones that are avoidable, how can we prevent them? How can we teach the system so that changes? And then in the end, the doctor is not the one paying the lawsuit. They have insurance companies that pay for this the same way that I have my insurance for fiduciary duties with the company. But it's still unpleasant to be in a lawsuit, right? You don't want it to be in a lawsuit, especially if you didn't do or you believe you didn't do anything wrong. So how can we help those professionals not make the mistakes or not being targeted in the lawsuit? Because even if you made a mistake, as a hospital, there are things you can do proactively to mitigate the damages from that mistake, so the patient won't get angry and won't want to sue them.
Well, and by giving that feedback to the system can then learn from it.
Exactly.
Now, another thing that I find very interesting is that when we have a multi-million-dollar suit or a multi-million-dollar judgment against a doctor, the doctor doesn't have to pay that multi-million dollars.
Often they don't. In some states, it's not required to have insurance. In Florida, for example, it's not required to have for them to have insurance, but in most states it is. So
Mm-hmm.
yes, they're not the one paying for the lawsuit. That the
It's
lawsuit
the
is going to the
insurance
insurance
company.
company,
Yeah.
who covers all litigation costs, all uh, discovery, litigation costs, and potential payouts.
And so the insurance company has a financial interest in having quality medical care, and the hospital and presumably the doctor have an interest in providing quality medical care. And when there's a mistake, it's valuable for all of those parties to know what the trends are, what the data is, what the long-term kind of picture is, so that they can begin to address that issue.
Yeah, definitely. And that's, as I briefly mentioned, that's actually why we have in our investors, our shareholders, we have a few doctors actually. And we have two people from insurance companies, one insurance company, one C-level executive from an insurance company, and people who understand, who worked in hospitals, because it is necessary to change this. Having 440,000 deaths a year from medical mistakes is something that has to change, not just because of medical malpractice, but because that's something that should not be happening, right? And they happen for a lot of reasons. So how can we help mitigate these issues? And in the end, mitigating the issue is better for everyone. It's better for the patient. Is the best thing for the hospital, for the doctor, for the insurance company. Maybe it's not the best thing for the plaintiff attorneys because they won't have the cases to litigate. But in the end, it's if we're making everyone prevent medical mistakes, it's a win-win for most people. So we're happy to look for mitigating those mistakes.
Well, do you see the time when there will be zero malpractice experiences?
That's a good question. I think it's difficult to avoid all mistakes, right? It's almost like if you're thinking about engineering mistakes, like someone built a building. Right now we have very strict regulation that engineering mistakes don't happen very often because one is not as complex as medicine, because I acknowledge the medicine is more complex. But second, we have a lot of regulations that make sure that we do not have mistakes. Each project is several $1 million, so allows us to spend the resources to make sure that building is not going to fall if there's an earthquake, right?
Mm-hmm.
But still we have engineering accidents, right? You still, with all the system being easier and being easier to regulate and to make sure that everything is right, we still have engineering mistakes because of so many varied reasons, right? Maybe one drug came out of manufacturing and it was manufactured the wrong way, so it's not even a medical mistake, it's more a product liability issue, but it's in the medical context, so it could be construed as medical mistake. Not by the doctor, but from the pharmaceutical company. So those things are more difficult to to make them stop 100%. However, if we can reduce it even by 50%, I feel like it would be an amazing win. For me, it's interesting because working in the space, we are training these algorithms, the AI, to detect past medical mistakes, right? We get medical records and we are training it to see, this was a medical mistake. Can you detect the same type of mistake in this other medical records? Mm-hmm. And we do this after postmortem, after something happened, right? But the same models, the same AI that we're using right now for after a mistake happened, once they're well trained and, to the clinical grade, they can be used in the clinic to prevent medical mistakes. And that for me it's the most exciting thing about what we do, because if you can prevent medical mistakes from happening, you're saving lives, right? Mm-hmm. And it's not always that you have the opportunity to change the outcomes of lives so much. So that's one of the long-term goals, the blue sky goals that we have for the company.
Mm-hmm. Well, that and also identifying those people who have the right values as the attorneys have the right values, and those attorneys who are competent, able to find a good judgment for people who suffered.
Exactly, and you have this review system for everything nowadays, right? For Uber drivers, which is a much lower stakes situation. You're gonna mm-hmm. take an Uber to your family member's house, and you have the reviews. You know how much you can trust that Uber driver. Mm-hmm. But for the medical practice attorneys, you don't have that. You just have a lot of ads, and it's difficult to know who are the good ones, and once they're good, what they're good at specifically.
Yeah, and I mean, and what drives those ads in terms of content is almost a Bernaysian mentality. What do we need to say in order to get people to pick up the phone and call? Right. Yeah. That's not the way to run the system.
Yeah, and yes, and you often end up with very cheesy ads, right?
Yes.
From and then very, very cheesy URLs, like willfightforyou.com.
Right.
alldayouneed.com. Those are all made up URLs, by the way. I'm not singling out any specific attorney. But the idea is that those are two very different skills, right? One of them is marketing. Mm-hmm. Even if we see as cheesy, it's like a marketing skill. The other one's a legal skill. They're so different. They're different, completely different disciplines, university, right? Like marketing and law. And now you're judging an attorney on their law skills based on their marketing. Yes. So that's completely misplaced. It doesn't make any sense. Right. It's almost like I'm going to judge my doctor based on how well they cook. No, those are different things. They're uncorrelated. You should not be making those choices based on that. But right now there's no option, right?
But that's what you're providing is you're providing exactly. data, which I mean, what 99.99% of people who suffered a malpractice incident, a medical malpractice incident, to their detriment, they have no way of accessing that kind of data.
Yeah, only if you work in one of the insurance companies and you know this data. It's difficult to know, and so that's why we want to make it available. And then we make sure that one of our core values is transparency. So we share these insights every now and then with the media. So when we have, for example, we know that recently we noticed that whenever there's a surge and a spike in death, especially from the elderly population, because of COVID, and we're in the third spike of death in the US because of COVID. 2 to 2.5 months after that spike, you have a spike in lawsuits. And that's something that we noticed. And then when we dug a little deeper to see why those lawsuits, what was the topic of them, it was very curious that the lawsuits were not related to COVID. They were related to negligence, basically not being seen by a doctor, not being seen by medical staff. And it makes sense, right? Whenever the hospitals are the most crowded, you don't have enough staff to take care of the most basic needs of other patients, right? And then especially the elderly population suffers more. Mm-hmm. So those are insights that whenever we like to share with the media, because that's helpful for even hospitals understanding, are we committing too much negligence? How can we prevent this from happening? I know that's a challenge right now. It's a big challenge.
Well,
but we feel like the more data we share, the better.
Yeah, absolutely. Because then they have data, because it's so often it comes down to, if we continue in this route, down this path, our insurance our insurance premiums are going to go up this high annually. And so what if we took some of that money and invested it in expanding our services or creating relationships with other institutions? Are there less expensive ways of achieving the same, of providing service for people?
Yeah, that's a good point. Like a proactive approach versus a reactive approach.
Mm-hmm. Yeah, and it seems to me that what you're doing is you are giving data so that people can make decisions. Because to simply say, well, there's no way we can expand our services, there's no way we can put more people on, there's no way we have more ICUs. Okay, as long as you believe that, it's not going to change.
Yeah, and exactly, and acknowledge that during COVID is tough, right? Because this was
yes.
tough. However, it's crazy for me the number of new, just recently graduated medical students who right now cannot find jobs, and
Really?
it's one of the highest that we had in the last decade, and it's a little bit of a contradiction, right? Because we need them to enter the workforce, but they're not entering the workforce. So that's kind of some of those data points that maybe you should be investing in them, training them. I know it's more expensive right now to train this personnel because everyone else is busy, but it's important that we increase the number of doctors that we have in hospitals.
And what I have found is that insurance bill can be a very, very effective lever in making behavioral changes.
Definitely. If you decrease it, like with car insurance is similar, right? If you allow them to put that little device that they measure your driving, it decreases your insurance, but also you know that you're being tracked, and you want to make sure that you're proactively doing the things that the car insurance company wants you to do, so they don't increase the premium.
Well, one example is clergy sexual harassment issues. For years in churches, that was we want to deal with it behaviorally. We want to tell people not to do that. We want to move people around if they get into trouble, all sorts of ways of dealing with it at a very superficial level. But along with that came a lot of lawsuits that, guess who had to pay? The church insurance companies had to pay it. And so when they finally said, we've had enough, you must stop this. If you do not educate your people about sexual harassment, you will not be covered by our church insurance. Boom! It changed everything. Yeah. People began to be educated every year. They had to get recertified. Behavior changes because of people who have a financial interest in seeing that behavior change. And I think you are providing the data. I think the insurance companies are going to, when they have your data, I think they're going to help doctors and health institutions make changes.
Yeah, we strongly believe that, because it's in the end, it's helping everyone financially. So, there's a few different reasons for them to adopt it. We're actually also part of an accelerator from an insurance company in Hartford, Connecticut. And the idea is exactly that, where as I mentioned, we have investors. We are part of an accelerator from insurance companies that credited to help companies that might help them, right? And the idea is that as the technology keeps evolving, it becomes even more appealing for the insurance companies to also adopt it. And I was talking this week to a specific trade publication for medical malpractice defense law firms and insurance companies. And that was the main pitch right now. We're working with the plaintiff side. We're helping them. It works. We've been growing at 16% a month, which is, good. We now have hundreds of law firms on the plaintiff side we're helping. And my pitch to them, I asked was, how can I help you guys? How can I, because I come from the defense side. I come from working in hospitals my whole life. My mom is a provider, so my whole family. So how can I help you all on this space? So right now, a few of them reached out. So now I'm talking to a few people. So that's great. Excellent. Because it makes me excited to help both sides.
Well, yeah, it's the system. And it's amazing to me, just another example of how data changes the system. And that's one of the 6 key competencies for this EOS system is You have the right vision, and you share it with everybody. You have the right people in the right place. And then you have to have data consistently coming in. And when you see the health system as a system, then getting data that's consistent, that people can depend upon, and that the kind of enormous amounts of data can only be handled by AI, right?
Yeah, it's too much data. It definitely for individuals it's just it's just complicated. Someone's going to be buried in data. And I'm curious, you mentioned two of the principles right now, and you mentioned there are four more.
Yes,
I would be curious to hear a little bit more about the other four principles.
sure. The key competencies are, number one is people, vision. Getting 100% of the people knowing exactly where it's going. You got to answer 8 questions in that vision. And the 8 questions are, what's your core values? And this is something that comes out of the leadership team itself. What are your core values? Number 2, what's your niche? What's your core focus? What's your 10-year target? Where are you going with this? What do you expect to achieve? What's your marketing strategy? Then what's your 3-year picture? What needs to happen in those short 3 years between now and the end of 3 years to get you toward that 10-year target? Once you have that, then it's fairly easy to have a 1-year plan. What do we expect our revenue to be, our profit, our measurables, and then 3 to 7 goals for the year. And then what are we going to do in the next 90 days? We call those rocks. What are the most important things we have to accomplish in the next 90 days? Because we're going to live in a 90-day world. 90-day world. We're going to work for 90 days, pick up our heads, take a look, and make sure we still agree on all the answers to those 8 questions. Then, how did we do? What percentage of those 3 to 7 company priorities, and then the 3 to 7 individual priorities, what percentage did we get to? And we want to get to 80% of those 100% done. We have a list of all the issues that we're going to deal with, and we have to deal with them a piece at a time, but we keep that list so the people are there. And then process, the 5th of those 6 key processes, 6 core competencies is process. Let's take the core processes in our company and let's document them. Now, not 70, 80 pages a piece, but 2 or 3, so that we have an entrepreneurial, 20% of the work to get 80% of the value. So document the process and then train people so that they're followed by all. Everybody follows the best and most effective and efficient and productive process. And then finally, the 6th one is traction. Now, it's, traction is at the bottom of the circle, vision's at the top. It's not a surprise that traction's at the bottom, because what we say is vision without traction is hallucination. So traction is we have a meeting pulse and rocks. So eventually everybody in the organization has at least one thing that they're going to get done in the next 90 days. We have a meeting every week, and we teach people how to make that meeting the most effective meeting possible. Same day, same time, starts on time, ends on time. All of my companies right now, all of my clients are doing these weekly meetings remotely. So they know exactly what the same agenda every time. Keep the company clear on how we're making progress and then solving issues. Those are the 6 core competencies that we believe, and we've seen when you get to 80% strong in every one of those 6 key, the problems just fall into to being solved by strengthening each of those 6 key competencies.
Yeah, and it's so important, right? The recording, the one about documenting, is something that we didn't do too much in the beginning, because things were changing, we were pivoting, and now, now we're just thinking, oh, we should have done earlier. So now we're going back and documenting everything, because now, as I mentioned, we're growing from a team of 10 to 40 within this year. And as you have to bring a lot of people, you have to have things documented, right? Otherwise, if all the knowledge is passed by word of mouth, you're going to spend so much time just training everyone, and people cannot necessarily easily remember all the things. So it's good to have everything documented. So we're doing this now. But I realized that maybe if I had done it 6 months ago, it would have been we would be in a different spot.
Yeah. And so we want to document it, and then we want to train people so it's followed by all, right? That's important. Well, this is wonderful. I salute you, Victor, for the work that you're doing. It's going to make healthcare, not just malpractice insurance, but make healthcare better with the kind of data that you're able to provide for them.
That's our mission. Yeah.
Good. So what would you like to tell people? Is there anything you'd like them to do?
Not necessarily. If something happened to, of course, someone that in this space is something we can help. Right now, we're just trying to get the word out. So explain to people what we do. We've talked to a lot of people who had a medical mistake happen to them, and then they ended up choosing the wrong attorney and ended up with no payout, nothing, not because they don't have merits on their lawsuit, just because they chose the wrong person. So right now, our work is getting the word out and explaining what we do if they're on the plaintiff side. If you're on the defense side and they work at a hospital system, at an insurance company, at a medical malpractice defense firm, we want to help. So we are having conversation with a lot of people right now about pilots that we can run with them. And our main goal is like to add value to them. So we're flexible, we're running pilots. So if that happens to, either of those scenarios happens to fit anything from someone who's watching the show, it would be great if you reach out.
So if I have a medical malpractice incident, I should go to
Justpoint.com.
Justpoint.com. And if I'm an institution, hospital, clinic, insurance company, and I want to talk to you, same place? You
can reach out on hello@justpoint.com. And Excellent. Then we will reach out about partnerships, collaborations, anything that might be helpful for them.
Excellent. So thank you so much, Victor, for being with us today. And what this is just another example of how businesses, entrepreneurs, seeing problems and solving them thrive, especially in California.
You've been listening to The Pilgrim on the 405 with Will Christ. To hear more of the programs in this podcast, go to www.willchrist.com.